I got great questions that led for this live topic today. Is bracing bad for you? Does it cause weakness? Does it cause you to get worse? Should we not be doing it? These are the types of questions I get a lot of the time, particularly in talking about things like hypermobility, EDS, Ehlers-Danlos syndrome, POTS, FND, you name it. A lot of people have been told not to wear any braces or orthotics or things like that, that they're, quote, bad for them. And I'm here to dispel the myth. So, hi, Sue. I see Sue has joined us. Thank you so much for joining live, or if you're going to catch the recording afterwards, I just want to say hello and thank you. Thank you for these great questions that really drive me daily to read literature, to share about it all of the time. If we haven't met, my name is Julie Hirschberg. I am a neurologic physical therapist and the owner and founder of Reactive Therapy and Wellness. We're in the Los Angeles area, and I do a lot of work with people with all kinds of different complex or chronic health conditions, and I work very closely with clinicians. And I will say, I think I actually get this question more from clinicians, and particularly the question of, do you have some research to show that it would indeed be okay to use bracing with a patient? Because there are some myths out there that this is detrimental, and you'll have physicians say, no, you shouldn't have bracing, or maybe not even prescribe or recommend it when it would be very beneficial. So during the last, I would say, couple of weeks, I've been diving into the literature, and somebody specifically asked this question on one of our videos this week about bracing and the literature. So there is a lot. I will say I've probably read about 30 articles. I'm not going to share all of them, but I am going to share 3 key articles today. And particularly, they are related to hypermobility because it's EDS Awareness Month. So this is a very important topic for people with EDS or the clinicians that work with them. So I'm going to start, maybe surprisingly, with, I think it's this one. Yes, with this particular article, and let me pull it up for myself as well. This article by Campbell and colleagues from 2019, which, by the way, there's a lot of research in this area, and it's old. I'm going to say it's really old. I actually went through to pick articles that were from the last decade because there's a lot of stuff from before, but the messages are really common. Now, I'm starting with this one because this is not really about bracing. And I think this is where some of the myths or misnomers come when people talk about bracing and devices for people. This is about immobilization. This is immobilizing a joint like in a cast or a really hard splint or brace that would prevent you from moving. And this was a systematic review to look at many studies that looked at immobilization. And immobilization does make you weaker, decrease some of the brain to body connection for that area. And we knew this, right? So we knew that when somebody gets a cast on, let's say on their arm, a broken bone, surgery, we know that atrophy in the muscles occur and strength loss can occur. In fact, quite rapidly. And this is one of the reasons we will only immobilize people for kind of the worst case scenario things. So I'm starting with this one because I want to differentiate too. This is immobilization. And when we're talking about bracing in hypermobility, we're not typically talking about completely immobilizing a joint. We're talking about supporting around a joint usually so that the person can use it more effectively for a functional task. That's not immobilization. But I just want to hit on this because this particular systematic review, they found 40 studies that met criteria. And it looked at immobilized lower extremities and immobilized upper extremities. And they looked at the aggregated results in this, and they found muscle strength decreased, muscle size decreased, and it seemed to really be related to the central drive from the brain. This is not surprising. When you immobilize something, meaning that you can't move that joint, your brain's gonna be like, thank you, I'm just going to stop sending signals that way. And so this is something really important to consider, that sometimes we do find people can develop symptoms after immobilization, like CRPS. So maybe after an injury, a fracture, a surgery, and that immobilization, they might develop some symptoms like CRPS, which may come from the brain changes that occurred as well. So the first study is immobilization, casting, rigid bracing that doesn't allow you to move. These are the types of things that can decrease muscle strength and cause atrophy. Now, I share this, and by the way, I'm going to share the links to all of these studies as well as this video in our newsletter this week. So after I post the recording, if you pop in there and comment newsletter on that, I'll send you a link to sign up for our newsletter. So I wanted to start with this one because it is immobilization and not bracing that can indeed cause weakness and atrophy in a muscle. But now let's talk about two other ones. And by the way, if you have questions, send them my way. I think this one. I guess I grabbed a screenshot, and I guess I must have highlighted it here. So let me pull up this study. This was from 2023. This is the impact of podiatric, so like in podiatry, right? Intervention in the quality of life and pain in children and adolescents with hypermobility. So I chose to review this study because it was a lower extremity one. I also have one for the upper extremity. And also there's not a lot of studies specifically looking at hypermobility and specifically looking at these types of outcomes. And what I really want to reinforce is I was looking specifically to find evidence that wearing a particular type of bracing might make a person weak or their outcomes worse in some way. And I will tell you, I could not find that evidence anywhere. It doesn't exist. In the world of hypermobility, there is no evidence that bracing makes somebody's life worse. Now, it doesn't mean that there aren't some side effects or cons of bracing, right? So even in this study, when they looked at it, some people developed blisters, right? So these were just looking at orthotics in the shoes. For some people, I mean, here's a con, you can't put them in every shoe, right? Like you can't put them in your sandals. What if you like to walk barefoot, right? So there's cons to bracing for sure, but there's a lot of benefits. And so I do want to talk about this particular study. It was out of Australia, and they looked at 53 kids with hypermobility, and they were aged 5 to 18 years old, and they were fit with custom orthotics. Now, if you're new to the orthotics world, I've worn custom orthotics probably, gosh, it's almost been 20 years myself. And that's an orthotic that goes in the shoe that's custom made to your foot, but you can also get really great off-the-shelf orthotics too. Custom orthotics, another question that I get from a lot of people about a lot of bracing needs is they're expensive. Custom bracing is expensive because you have somebody hand making something for you. It's often not covered by insurance as well. I know I've paid out of pocket for every custom orthotic that I have had. So in this particular study, they did do custom orthotics, and then they looked at people pre and post and looked at their pre and post wearing them at a month and 3 months. And they looked at what their pain levels were, what their quality of life was, and some of their functional measures. So that's really nice. They looked at kind of a broad scope of outcomes. And maybe not surprising, it was really positive for this group of people. So let me give you some of the outcomes. And I'm going to show you a picture from this study too, because I think it was really helpful to see this. So they found that wearing the foot orthoses had significant pain reduction, improved quality of life, better functional capacity, and less fatigue. And did they measure strength? No, so they did not measure strength with this. However, one can really deduce if a person has less pain and better activity level, they're actually going to improve their strength because they're doing more things. And so I want to share this picture here from the study where they showed a person's feet that you can see. So a hypermobile foot tends to be in excessive pronation. They show the foot up in A, and then B, and then C, you can see in the orthotic, the position of the foot. What I really like is the kind of screen capture of the walking there. So you can see a very typical foot position into excessive pronation, probably really wearing down the inside of that person's shoe as well. And then in the second photo, you can see what it looks like with the orthotic. Now, this doesn't mean orthotics are miracle things for everybody, but in this group of people, they were really beneficial. And I think that is a great take home. I saw a question come up here. I wear bilateral custom-made AFOs, KFOs, and thumb braces, as well as a shoulder brace when needed. They have changed my life and allow me to live with less dislocations and pain. Beautiful, Callie. Thank you so much for sharing that too, because this is what I see on a daily basis. This is clinically what I see when we can give somebody support that reduces pain, reduces dislocations, improves alignment. They're able to do more, and therefore they are even stronger. Now, there also are some really great articles and review articles looking at the overall care and management from a physical therapy, occupational therapy, rehab perspective for people with hypermobility. And across the board, the evidence is that a person can wear and be supported by bracing, and it's really helpful to do strengthening and other activities for the brain and the body. Another big help to this, just thinking back to your comment here, Callie, is that bracing can provide sensory input. And we've talked a lot about the sensory system, and we've talked about some of the literature specifically in hypermobility and POTS and the sensory system. Bracing can provide extrasensory information to a person as well. And so sometimes that is really, really helpful for a person's mobility to help decrease dislocations, but also just to increase their ability to stand, walk, even run, do intensive exercise, right? So Kelly, I'm thinking specifically of you with a KAFO. So by the way, if you're not familiar with that, AFO is an ankle foot orthosis. A KAFO is a knee ankle foot orthosis. And depending on the types of those, they can actually be really heavy, which is one of the cons of some of these things. But that heaviness also gives sensory input. So for some people, that can be really helpful. I don't regularly recommend KFOs for people. I did use them a lot in patients with spinal cord injury, and they are not super practical because they're a very big brace that's coming way up and can be really heavy. But for some people, very, very beneficial. Now, some of the other things, just thinking about the bracing in the lower extremity, for some of these, they not just the heaviness, it's the how hot they can be. So depending on the materials that things are made of, this is probably one of the biggest cons that I hear from people of like, this feels great, but also my temperature is not well regulated, and this is making me hot. And so for some people, they're like, I don't even like to wear shoes, right? Or socks. I like to be in sandals. And so having a foot orthotic and a sandal isn't going to work. But some of the bracing options are just hot. And so they're, for some people, not very practical to wear. Another question coming up here, and I got a bunch of questions sent to me as well, so I'll answer these at the end. I have one more study I want to get to. Symphony of a Poet. Oh, isn't that beautiful? Do you know if there's any way to get insurance to cover orthotics? I think every insurance is different. I've always had really fabulous insurance my whole life that covered a lot of things, and it never covered my orthotics. I can't really tell you why. And they're really expensive. But I will say this. I worked with an amazing foot and ankle specialist, physical therapist, and we would actually take, I almost like want, I'm going to grab one. Why not? Since we're here and I have my shoes here. This one's not even one of them. Okay. Well, we would take an off-the-shelf orthotic, and he would actually add some customization to the off-the-shelf orthotic just to lower the cost. So I think you can get creative. There's some really good off-the-shelf orthotics. In fact, I started kind of switching to these because I'm training for a marathon and I wear down my orthotics a lot. But there's some really good brands of off-the-shelf orthotics, and you can just try them on with your physical therapist, and they're $20 to $30 instead of $300. Yes. Okay, so Symphony of a Poet is saying, my insurance has been insistent on only DVT or diabetes. Yes, if you have diabetes, like, you can get custom shoes and custom orthotics because you're at a high risk of wound. Anne Leclerc 630 said, my insurance covered mine in full. Woohoo! Okay, I'm celebrating that with you. Every insurance is different. And it would be a really good question to ask. And I will say, I paid out of pocket for mine, and it was worth every penny. When I first got my orthotics made was when I was first diagnosed with rheumatoid arthritis. I couldn't stand. I literally could not stand on my feet, and I'm a physical therapist. And I was in excruciating pain, and I got custom orthotics made, and I could stand. Like, deal breaker. Like, it is worth every penny of the $300 that I paid for those orthotics. But gosh, if your insurance can cover it, amazing. I am going to do another live at another time and share some of our favorite braces and different orthotics and things like that. Neck braces, back braces, posture braces, fingers, hand, wrist, all of those pieces. So stay tuned. We're going to do another thing on that. Okay, so this was the orthotic study. Take home point, decrease pain, improve quality of life for people with hypermobility in this study. Now I'm going to share the third study here. Here it is. Finger orthoses for management of joint hypermobility disorders, relative effects on hand function and cognitive load. This one, like, I was so thrilled about. I mean, first, when it comes to hypermobility, we use finger splints a lot. So I was really interested to look at this study. Let me get the year for you also. This is from 2020, so fairly recent. But what I thought was so cool about this study was that they not only looked at the effect of the finger orthoses on a person's hand function and the time that it would take doing a task, but they looked at their brains and how much their frontal lobe was working to do the task. And I just love this study so much. I was so excited about this combo of things. And this is from a group in Denmark and Sweden, I think. But they looked at this with people with hypermobility. And what they did is they did several functional hand tasks with and without bracing. And let me give you an example. I see another comment here, Callie. Thank you. And I'll get back to that in just a second. I just want to share this. They're kind of small, so maybe you can't see it, but if you look closely, this is one of the tasks that they measure, which was a coin task, picking up a coin and moving it. The first image is without bracing, and the second image is with bracing. And you can definitely see the finger hyperextension going on without bracing, and then see that it's better with the bracing. So this is what they did. They compared this for several tasks. People were faster with bracing. They could do all of the tasks much faster, which is great. Clearly we can see there's better alignment too, but this is what was really interesting. They looked at prefrontal cortex of the brain. They looked at activity there. And with this particular task, not the other task, but this was the more difficult of the task. With this particular task, they found that it reduced the cognitive load, reduced the dorsolateral prefrontal cortex activity. And they did this with a monitor that looked at oxyhemoglobin activity in that area, oxygenated hemoglobin. And they use that with near infrared spectrum. So this was not a functional MRI study. But how cool is this? How cool is it that using a brace on the finger that improves the task could actually free up your brain for a little other activity, right? So reduce the cognitive load. What I like so much about this, so again, this particular study didn't say, well, you don't get weaker. It says you can do things faster and you can decrease the attentional load on the brain. Honestly, I think this is even better than weaker or not, because I hear daily from people with hypermobility who are exhausted by paying attention to their body because they're not getting great proprioceptive feedback from their joints. And if we can use some sort of bracing to help with that so that they can move freely without thinking about their body as much, we've just opened up their brain to such possibilities, decreased their level of fatigue. And honestly, as I was looking at this in this brain activity, also decreased the potential that they might develop something like a functional neurologic disorder, because a functional neurologic disorder is this change in network connectivity in the brain, particularly related to this attentional focus. And so if a person has a disorder like hypermobility, but also a lot of other disorders, MS, Parkinson's, stroke, where you have to pay attention to your movement a lot because you're not getting good sensory feedback, that could predispose you for developing FND. So potentially, I know I'm making a long leap here, but potentially we could decrease a person's fatigue, improve their function, and decrease their risk of developing other things by offering them bracing. It is not a bad thing. As Callie is saying, so Callie, I saw you had a couple comments here, so I want to get to both of them. Callie, full of the wisdom, by the way. Finger splints are so helpful. If you can't afford the metal ones, the oval 8s are a more affordable way to achieve this. Yes, and Callie says, what a fascinating study. So cool. It is so cool. So at our clinic, and actually I have a bunch of the figure 8s here because I've hurt my fingers many times. So the plastic figure 8s, you can get them at the drugstore. You can buy them online, really inexpensive, and they're like the skin color. This particular study, these were people already had these, and they were metal braces, which are more expensive. But there's some really cool looking ones. Like, they look really cool. Callie, you had another great comment I just want to go back to. Callie says, depending on the type of KFO, some have more material than others. For me, the pros outweighed the cons because I can now put weight on my legs without my hips dislocating and falling. So brilliant, Callie. This was the main point of this talk, is that if bracing can help a person participate in life, do activities, honestly, get even stronger because they can put weight on their legs, so prevent other sequela of not being able to put weight through their joints, like osteopenia or osteoporosis. If they can do those things, oftentimes the pros outweigh the cons. But as Callie mentioned so beautifully here, it really is a personal, very personal decision. I know a lot of people who would just do not ever want to wear bracing. And I have other people that are bracing every joint because they've, maybe like Callie, dislocated or fallen and weren't able to put weight on their legs, right? So it's such an individual decision. Now I'm gonna stop sharing here because I see some more comments, and I had people also, oh shoot, sometimes I lose the comments and I'm so sorry. Let me see. I saw something else come through here. Okay. I think it was Sammy. Yes. Do these help keep the fingers straight? Yes. So again, I'm going to do another live and some more posts because it's EDS Awareness Month to show some of the finger splints and other splintings that can be helpful. But yeah, they can help if you're having a lot of dislocations, pain in the hands, slowness in some of your fine motor. The splints can be really helpful, as this study showed. So I want to get to some other questions that came up. We have a membership actually for people with hypermobility, POTS, MCAS, all the zebra conditions. It's our zebra membership, and I reached out to those members for questions as well. And you all brought up some of these same questions. So where do we find braces? So I will say a lot of what I do is work with a person individually to see what kinds of things they might need. I've learned a lot from the community of people with hypermobility. So thank you for teaching me about what has been helpful for you. So I think that's a really great way to hear about what's helpful for people. The EDS Society has some of those resources as well. And I got a lot of questions about kind of custom bracing as well and getting insurance to cover it. So custom bracing is the more likely to have insurance coverage. You typically would work with a orthotist, prosthetist that would design something custom with you. You can also do it with occupational therapy, physical therapy, or a podiatrist, like the study with the orthotics. That those particular braces are more likely to be covered by insurance. Something that's off the shelf, not typically covered by insurance. To get things covered by insurance, so my experience has been that I typically, as a physical therapist, I'm working with an orthotist who will create a custom brace. We're working together to write a letter of medical necessity for that and present that to the insurance company. So that's one of the ways to get them covered. The other question was, what can bracing do? So we've talked about two examples, fingers and feet, but as Callie said, AFOs, soft ankle braces, soft knee braces, hip or SI braces, lumbar braces, thoracic or postural braces, even cervical collars, all can be different types of bracing that a person might use. And it's multi-purpose. So part of it, I think a big part that I see, it's sensory input. So for a person with hypermobility of any type, having excessive range of motion and not accurate proprioceptive input from the joint can lead to a lot of difficulties with movement and a lot of fatigue because your brain is on overdrive trying to figure out how to move your body, and brain fog, all of those things. Like when you ask what can bracing do, I think it can help you with your brain fog indirectly because you don't have to attend to your body as much because it's getting a little more feedback at your joint level. So, but it can stabilize. It could give that sensory input. It could decrease pain. Now, do I think it's a miracle worker? No, I don't think bracing is everything. I don't think bracing is the only thing. And I think that's another thing. The clinical guidelines for us as clinicians working with people with hypermobility are not like just brace people, right? It's bracing, it's sensory training, it's strengthening, it's all part of the pieces that help people thrive. Another question was, how do you know if bracing would help you? You try it. This is like, that is the best way. I would have, so before, one of our favorite braces called the body braid. It was designed by a person with hypermobility. And you can use it multiple ways to support multiple joints. I would have never guessed, just looking at that, how helpful it would be for people. But we try it out, right? And some of the companies do allow you to try things and return them if they don't work, because a lot of these things are expensive. Or you can work with a physical therapist, an occupational therapist, to trial these things out and see how your body responds. Everybody is so very different. Callie has said, that has been my experience as well. Greatly reduces mental fatigue related to proprioceptive input. All right. Thank you for validating that, Callie. I hear that a lot from people as well, and I see it as part of their journey. And in a small way, this finger study that showed the decreased frontal cortex activity, it validated that also. Like, this is decreasing the mental load. AM Clur 630 said, agreed. The first time I put AFOs on my leg, I was able to walk across the floor to my very stunned husband. Oh, it helped with all the extra movements I had. It calmed the leg stutters, as I would say. That's a really beautiful way to put it. And like, what a great story, with your husband witnessing that as well. So the best way to know if it would be helpful is to work with a therapist to trial these things out. And then another question was, what are some of the reputable bracing companies, brands, places to purchase? So again, all of these great questions on specifics like that, and I'm going to do a whole nother live and some posts to show some of our favorites. And some of them are just things off of Amazon. Like, I am a bargain shopper, I got to tell you that. But there are some particular companies that, even from like my sports and orthopedic days, which I will say that was like when I was in PT school, I worked at a sports clinic. There were a particular couple of companies with bracing that was just, it was better quality, it lasted longer, and we'll talk about those as well. And Trina is saying, my knee brace definitely helps my F&D wonky movement. Yeah, so I love a good soft knee brace for the person that maybe needs more sensory input around their knees. Somebody else. So here's some of the other questions that I got. Another one, similarly to the last one, how do you decide when you need to do it? So this is, again, a very personal question, and not everybody needs bracing. So I'm not here to say like bracing for all, like you get a brace. No, like that's not what we're talking about. I'm talking more to the people who maybe have been told, don't do it. It will make you worse. It'll make you weak. You'll become dependent on it. That's just not in the scientific literature. It's not true. It's a myth. So I'm really trying to dispel the myth, but I'm not trying to say everybody needs bracing. That's not the case. And many people with hypermobility can do really well without bracing. So deciding when you might need to do it, very personal decision. The things that I see or hear from people is that they're having dislocations repeatedly. They're having pain. They're trying to avoid surgeries. They are losing some of their function, like they're losing function in their hands. And I'll even tell you personally, I don't know if you can see my lovely finger there, but I dislocated my finger swinging on a rope swing in Hawaii to jump into the river. And and I didn't stop, and I kept swinging on this dislocated finger. Well, I lost function of that finger. And so it was because of that, I started wearing bracing, right? So that was a very personal decision for me. So it would be very personal to you. This was Peyton's question. Are you losing function? Are you in extreme pain? Are you not have you stopped doing some of the things you love? You might consider, could these help you stand, walk, write, a button, right? Could these things potentially help you with those function? Another question I got was just about the different types of bracing. So again, I'll do a whole nother session on the different types of bracing. Kinesiotaping was another thing. Kinesiotaping or other proprioceptive ideas for the hips. So this is another thing that I think about a lot when people ask me about bracing. I think it's best to start with the least restrictive, the lowest amount of support first, right? So because one, supports are heavy and hot, and expensive, and I want people to be able to move as freely as possible. So kinesiotape is a really great way to start. It's not super supportive, so it might not do anything for you. But if it's the sensory input that you're needing, that's primarily what taping does, is change the sensory input. This could be a really great place to start. Now, this person is asking kinesiotape for the hip. So my body particularly responds very, very well to taping. And I've had a lot of hip issues over the years, including a hip surgery. There's many different ways we could use kinesiotape at the hip. It really depends on the person, their movement patterns. Are you trying to facilitate maybe some particular muscles to be supporting the hips? But one, yes, I would try that. In fact, I might try that around any joint first, because it's a very, very low level of sensory support, of joint support. And then I would kind of go up from there, right? Then I might use a soft brace. I might try something as simple as an ACE wrap. So, because that's really inexpensive and it's a good way to trial compression. At the hip, I love an SI belt. I know this was something that myself and many other people who have been through pregnancy have used an SI belt because of the laxity that occurs at the hips. But that's another really great place to start, at the hips. And it's not restrictive. So I think that's the other thing. When it comes to bracing, you do want to trial the least amount of support so that you can have the most freedom in your movement, right? So once you start locking down joints, and remember, in that first study that I showed, locking or immobilizing a joint, meaning you can't move it, that will actually lead to weakness and to atrophy. If you never take it out, if you're not doing any exercise or strengthening in that joint. So that's not really what I'm talking about. And we want to kind of keep the person as mobile as possible. So starting with some soft bracing and things can be a really, really good way. What Callie is saying too, that's what I did as well. It helped me figure out which joints needed custom bracing and which needed lower support. In some instances, I found, this is great, I found lower level supports more helpful for the individual joint. This is so person specific. But I love that you share that, Callie, because you might need more support in one place and less support in another place. Trina said, I tried the ACE wrap for my hand tremors, but no luck with it. So this is, Trina, very common. We try these things and it does nothing for us, or maybe it even makes things worse. It wasn't the right amount of input that you needed. And that's actually really helpful to know. So if you do try things and they made things worse, don't just beat yourself up for it, or beat your therapist up for it. It's actually providing really good information about what you don't need, right? And that you might need something else. But the ACE wrap is a good place to start. Okay, last question that somebody asked, it was, what I really need is a neck brace, but no one will prescribe one. I get it. Doctors are scared of it. And this was Eugene sharing this comment. So neck bracing is a whole other topic that I would love to talk about as well. And actually, your question kind of sent me, Eugene, down a rabbit hole of looking at some of the literature in this area as well. And number one, like, there are some very good neck braces that you can get over the counter now. And they're not super expensive. And I say this because we have a whole assortment of them at the clinic so that people can try them, right? So when it comes to neck brace, again, I like the least restrictive as possible, because when we immobilize the neck, we're not turning, we're not tilting, we're not looking up and down. We greatly influence our vestibular system, which greatly connects to our autonomic nervous system and all of our sensory systems. So there is a cascade of effect of wearing a neck brace. Now, some people need neck braces, right? So if you have instability and you're not surgically provided support, you might need to wear a neck brace. That's probably the most common reason that I see people wearing it, or they might be wearing a neck brace because they have head drop. So head drop can occur in a lot of neurologic disorders like myasthenia gravis, ALS, or those two are probably the most common that I see, but also in Parkinson's. So lots of reasons to have neck bracing. We shouldn't be afraid of it. However, we do need to keep in mind that restricting the motion can have detrimental side effects for our other systems. The neck especially. The neck more than some of our other joints because of how much it affects our eyes, our vestibular system, our sensory systems. Now, I'm not saying don't brace the neck, but brace it when you need it. And I would say use the least restrictive as possible. So nowadays you can get soft collars, really inexpensive, and you can get a really simple aspen type collar for really fairly inexpensive over the counter. There is, from this comment, which is really a main reason why I wanted to do this live, it comes from misinformation, right? Not your comment, but the doctors being scared of it, or clinicians saying, "Ooh, we shouldn't give you any devices." Like, there was one practice guideline that said no devices, no bracing. That is really not supported in the literature at all for hypermobility. Now remember, totally immobilizing a joint might not be helpful, but bracing appears to actually be very helpful for pain, for quality of life, for movement, maybe even decreasing brain fog because it's decreasing our attentional focus. And that's what the studies that I brought to you today really hit home. There's not a lot of studies. The studies I shared with you are pretty small. They have limitations. They're not large randomized controlled trials, but we do have evidence that bracing is not harmful. It's not, quote, bad for you. And as physical therapists, as occupational therapists, as speech therapists, we should be really aware of this and busting these myths, because I do hear from a lot of people that they were denied or never tried bracing and things like this because their clinician felt like it would be harmful. And the evidence just not there for that. In fact, we have evidence that it's really helpful. So I want to thank you so very much for these wonderful questions that really drove me to get curious and investigate more. Stay tuned for more. Our team is going to share some of our favorite things that we use and keep answering your questions. So keep reaching out with questions. I'd love to hear from you. I'd love to review the literature as well. And I will see you next time. Thanks so much. Have a great day.